Hello viewer, glad you have let me in your space. Welcome to Health and Flavor, a three-part program where we talk to medical practitioners on various diseases, learn a few tips with regard to clinical and nutrition intervention. We also have physical fitness segment since exercise is a large part of our well-being. Welcome to the program today. My name is Bill Hawaka and here is a preview of what to expect.
So now we repeat the same with some speed. Let's go.
All right.
Let's go. Faster.
Now this is running.
Yes.
The next thing which will be able to trigger asthma is obesity. It is very, very vital for us to check what we eat so that we cannot be able to add more weight.
That actually needs to be addressed because, if a patient has asthma and gets heartburn and acidity,
Yes.
it tends to make it worse actually.
Okay.
So that needs to be addressed because, acidity, for example, causes inflammation,
Yes.
inflammation of the airways and all that.
According to a report by Global Initiative for Asthma, South Africa ranks 4th globally when it comes to mortality associated with asthma amongst people aged between 5 to 35 years of age. We talked to members of the public and this is what they had to say about asthma.
More of it's an allergy, sort of an allergy. Yeah, an allergy, maybe it's sort of that.
I would say allergies, cat fur, dust, which is predominant in Nairobi, cold weather, extremely cold weather. So I would say those aspects, allergies. I would say, in my view, I think allergies are the most predominant factors causing asthma.
Asthmatic people, most of them are mostly affected by harsh conditions of cold. When they inhale a lot of cold in their chest, it causes some diseases to come up. So they end up having some problem with their chest. Yeah.
Asthma victims find it difficult to breathe and may trigger coughing and wheezing of the chest. Let us learn further about asthma with our medical practitioner.
Asthma is the tendency of the airway to contract too easily and too much to the allergens, which in most cases will have no effect or little effect on normal individuals. How will somebody know that they have asthma? Asthma has symptoms which, if somebody sees, will be able to tell this is asthma. However, how much, there are so many other diseases which present the same way as asthma, but the typical one for asthma is one, there's this we call wheeze. Wheeze in normal terms is if somebody is breathing next to you, you feel there's some sound which comes from the chest. Then the second, this person will complain of chest pain. Sometimes we refer to it as chest tightness. The other one will be breathlessness. I talked about contraction. If there's contraction, the breathing system will be narrowed. The airway, the passage for the air will be narrowed. This will bring breathlessness. But also there are some non-specific signs and symptoms in infants and young children. As we know, infants and young children, they never talk. It's something we see, we'll be able to talk about it. One, there's the recurrent infections, like you go to your doctor, baby will keep on having something called bronchitis, something called sinusitis, and pneumonia. If they are recurrent, you should be thinking, you should ask your doctor why, and that should be able to bring so many questions as to why to think this baby might be having asthma. And again, the recurrent colds and flus. These patients keep on coughing, having recurrent colds also. We should be thinking asthma and also the rattling of the chest. It is very, very important for us to always keep attention to these signs and symptoms before we go to the doctor, so that if we go, we explain very well whatever the baby or this person was going through. Now, what are these factors which will make somebody be prone to asthma? One, we have the environmental factors. In environmental factors, we have one like the house dust, the carpets which we have in our houses. The first question which will come is, how frequent do we change our carpets? Or how frequent do we wash the carpets? No, carpet is a source of dust in the house. So that house dust is one of the factors which will trigger asthma for these people having asthma. The next thing which will be able to trigger asthma is obesity. It is very, very vital for us to check what we eat so that we cannot be able to add more weight. Because the moment we add weight, we are going to be prone to asthma. And with research shows that the obese patients who are asthmatic will have poor control of asthma. So you get most of them are in and out of the hospital. So it's very, very important for us to watch our weight. Another thing which will predispose us to asthma is during pregnancy, something we call maturity, prematurity. If the baby is born at a premature age before term, this baby might be prone to asthma. The next thing is advanced age of giving birth is going to make this patient also be prone to asthma. The recurrent airway infections, recurrent sinusitis, will also predispose us to asthma. If you come to treatment of asthma, how do we treat asthma? Asthma has two modalities of treatment. We'll give you two types of medication. One will be a controller medication, and one is reliever. One which controls the attack and the other one which will relieve the attacks. But if one has asthma, does asthma get treated? Does this person get cured? No. It's just that in the treatment of asthma, we prevent the symptoms of asthma and also we prevent the morbidity and mortality from asthma. Because if person is free from asthmatic attacks, this person will have good days at job, no missed day at job, and no missed schools. So you get this person productive. So in management of asthma, it's very, very important for us to understand in that we're not treating asthma, but we're managing the symptoms and also preventing the morbidity from asthma. Now, I've talked about two modalities of treatment where we have reliever and controller. So if we talk of controller medicine, there's this drug which your doctor will tell you, this one you use twice a day. You use it in the morning and in the evening. It helps in controlling asthmatic attacks, because we say in asthma is where tendency of the airway to contract easily. So this one will be able to avoid this contraction, the easy contraction of the airway. So this drug will be used twice in a day, morning and evening. Most patients will get relief if they use this drug for 1 to 2 weeks. But to achieve a good control of asthma, this drug should be used after 3 months. The patient will have now a maximum control of asthma, but there should be continued use of this medication. The other one is the reliever medicine. When do you use reliever medicine? Reliever medicine, we only use it that time I have an attack. That's the only time I use it, because it acts very fast to be able to open the airway. These drugs are mostly inhalers, but sometimes you can be given the ones to take orally, the ones to swallow. So if you're given the ones to swallow, still they work the same, but mostly we use the ones which we use at the inhalers. Which is the major side effects of this drug, of this treatment? I've talked of two. There is only one. The one which is a controller is the one which is having the major side effect, because it's a puff which you have to do in the mouth. So sometimes it will make you have oral thrush. But there is a way we can always prevent the oral thrush. The other major side effect, actually this drug has two major side effects. That is the oral thrush and sometimes the roughness of the voice. But there is a way we can always prevent this. One, if you're given this medication, it's very, very important to get the spacer which is given. Most of for the babies, we always use spacer. Even for the adults, we still encourage the use of spacer, because spacer makes us to utilize the whole amount of medicine. There's no wastage of this medicine. If you use the spacer very well, we will reduce the chances of us getting the oral thrush. Asthma is one of the major chronic diseases worldwide. And as per the research done by World Health Organizations, it shows that currently 300 million people have been diagnosed to be having asthma, are living with asthma. And it's a projection that another 100 million will be diagnosed by 2025. That means by 2025 we'll be having close to 400 million people having asthma in the world. And asthma affects close to 7 million infants in the world. So that one we can be able to see the prevalence of asthma as we are talking today. With the good asthma control will lead to no lost day from job and no lost day from school. So always work hand in hand with your doctor so that we can be able to control asthma and reduce mortality from asthma.
While the surrounding environment plays a role in prompting asthmatic attacks in patients, certain foods are also known to activate it. Our nutritionist is here to tell us some of the foods asthma patients should avoid, which ones can add value to their health and help suppress asthmatic attacks. Hello everyone, welcome to Health in Flavor. Thank you for joining us for this nutrition segment. On set we have Mr. Kefa Nyanumba. He's our nutrition expert. Hello, how are you?
Fine, thank you.
Thank you so much for making time to be here with us. Today we are looking at a case study of asthma.
Yes.
Yeah, so then our patient, she's a 32-year-old female patient. Her name is Jane. That's not the real name of our patient. But then she came to you with some complaints. She was having frequent coughing, severe heartburn.
Yes.
Yeah.
Rapid breathing.
Yes. Because
such patients usually have issues with oxygen circulation.
All right.
And God really loves us because oxygen is actually one of the things that we need to survive.
Yeah.
Our cells cannot function without oxygen.
Yes.
So these are some of the symptoms that she actually presented.
Yes.
And we had to make a number of changes in terms of our diet.
All right.
Yes.
I can see that she complained of severe heartburn and acid reflux.
Yeah.
And for you, you're able to determine that as some of the conditions for asthma.
That actually needs to be addressed because you know, if patients have asthma and gets heartburn and acidity,
Yes.
it tends to make it worse actually.
Okay.
So that needs to be addressed because you know acidity, for example, you know, causes inflammation, inflammation of the airways and all that. So that needs to be addressed. Okay. And of course, talking a little bit about asthma, it's actually one of the respiratory diseases that is very common nowadays,
Yes.
and it usually happens because of what you call inflammation.
Yeah.
Yeah.
Okay.
Yes.
Oh, inflammation of
the airways.
Of the airways.
Yes.
All right.
Yes.
Okay.
Yeah.
So then you took a look at her dietary history.
Yes.
And you found out that she eats a lot of chicken and beef, but does not like taking legumes.
That's usually common with many people.
Yes.
That they just like animal proteins without plant proteins.
Yes.
But we recommend that, you know, we interchange some of these proteins because,
right.
yeah, they're good.
And she also doesn't like seafood, like salmon.
Yes, it's actually
sardines.
true, yeah. And, you know, as I said, one of the causes of asthma,
Yes.
the main cause is actually inflammation.
Yes.
And the challenge we have nowadays is the fact that the people take a lot of omega-6.
Yes.
Yeah, omega-6 more than omega-3. Now, these two are actually supposed to balance.
All right.
Yeah, so when you take a lot of omega-6 from foods like processed foods, of course, with the time you start getting inflammation.
Okay.
Yeah, that is why, for example, in the case of Jen, she needs to increase the foods that are good in terms of omega-3
Okay.
as part of the management.
Okay. Yes. Which now, in this case, is seafood.
For example, seafoods are actually very good for that. We have salmon, we have the sardines.
All right.
And of course, we have some of them that are in front of us.
Yes.
For example, we have the pumpkin seeds. They're actually very good in terms of omega-3.
Yes.
Yeah, we have the flax seeds,
Yes.
which are also very good in terms of omega-3, and so many other types of seeds.
Okay.
Yeah, so they need to be included as part of the diet,
All right.
and especially for Jane.
Okay.
Yes.
Then Jane likes energy drinks and spicy foods.
Energy drinks, I would not recommend them as such. She needs to cut down the intake of the energy drinks,
Yeah.
and of course, spiced foods are not that good
Or for
because
her heartburn,
yes,
things like-
spices actually tends to irritate the GIT.
Yeah. What is the GIT?
Gastrointestinal tract.
Okay.
Yes, and that of course tends to make asthma worse.
All right.
Yes, especially during the cold season, if somebody is taking spiced foods plus the cold season, that's a very bad combination.
Okay.
Yes.
Okay. Like you once said, it's like combining fire with petrol.
Yes. So it's not a good combination.
All right. Then I see that she also likes taking milk and wheat products like bread, pasta. Yeah.
Let me just start with the milk first. Okay, I would prefer that she gets rid of the cream from the milk because cream has what you call the saturated fats.
Okay.
And saturated fats actually take a lot of time for digestion. And for somebody who has heartburn acidity, that needs to change.
Okay.
Yeah, and
Do
of
you
course,
advise-
as that happens, of course, we are going to get a good outcome in terms of asthma management.
Do you advise that she switches altogether, let's say from milk to, let's say, soy milk?
Okay, the other sources of milk, for example, we have soy milk,
Yes.
which can actually replace the cow's milk.
Okay.
Yeah, because there's some people who don't actually take cow's milk because of what you call lactose intolerance.
Yes.
So we have other options like the soy milk.
Okay.
Yeah, but in case you really have to take the cow's milk, I would prefer that, you know, she removes the cream.
Yes.
Yeah.
Okay.
Yeah. Next is the wheat products.
Yes, the wheat products.
Yes, you talked about
Pasta and bread.
Pasta and bread. And, you know, she needs to make sure that she controls the intake of the wheat products. Like, for example, we have bread, we have pasta.
Yes.
Because wheat actually take a lot of time for digestion, so she needs to make sure that she controls her intake, not getting rid of the wheat product, but she can cut down the amount of foods she's actually taking from wheat. And she also needs to make sure that she tries to go for a test we call for a gluten test.
Okay.
For a test that would actually be able to determine if there's any intolerance to gluten.
Oh, okay.
Yeah, because wheat also contains what you call gluten.
All right.
Yes.
Okay.
So gluten is not very good, especially for the people who are sensitive to it, especially if they have asthma.
Okay.
Yeah.
All right.
Yeah.
So then again, I see for the legumes, we have some yellow beans.
Yes, legumes are also very good. And in the case of Jane, of course, she doesn't take legumes, but legumes are very good. It can be a source of proteins.
Okay.
Yeah.
Is it in particularly yellow beans or many other types of legumes?
We have different types of legumes.
Kidney
For
beans,
example, we have different types of beans, the kidney beans, the red beans.
black beans, yeah.
Yeah, we have other legumes like the green grams. We
Yes.
have lentils. All those proteins are good.
All
They can be
right.
part of our diet.
All right.
Yes.
Okay. And so tell us a bit about the pawpaw.
Pawpaw, okay, pawpaw is a very good fruit when it comes to the digestion.
Yeah.
And given that she's actually getting at pan acidity, so a fruit like pawpaw would be good.
Are pawpaw seeds edible?
Pawpaw seeds
Or
are
is
good.
it flesh?
Yeah, but we also need to be eating part of the seeds because, you know, seeds, as I said, have certain nutrients that we also need.
Okay.
Yeah, but of course you cannot eat all the seeds.
All right.
Yes, but seeds are also good.
Okay.
Yeah.
All right.
They're actually edible. Yeah.
So, unfortunately, we've come to the end of this segment. I wanted to ask you many more questions, but then we're running out of time. For our viewers back at home, this marks the end of this segment. Remember what our nutritionist has said. You can eat the pawpaw plus the seeds. Not all the seeds, but some of the seeds can be good for you and good for me too. A cold atmosphere and exposure to pollen grains are some of the trigger factors of asthma, making an outdoor environment unfriendly for asthmatic patients who will love to exercise. We went indoors with our fitness trainer, Mr. Nzuki, and presented the following physical exercises for asthmatic patients. Hello everyone, welcome to Health and Flavor. On this fitness segment, we're going to focus on exercises that are suitable for patients with asthma. However, these exercises are good for everyone. On set, you have Mr. Nzuki, he's our fitness expert, and today you're going to give us guidelines on asthma kind of exercises. Welcome.
Thank you.
How are you?
I'm fine.
How have you been?
I've been well.
Good to have you.
What about you?
I've been okay. I see we have an indoor setup. Yeah. Is there a specific reason why we have this kind of setup?
Yeah, because in most cases, people who have asthma, if they go running on a cold morning or on a hot day where there are pollen grains, there are dust, that weather or that environment might trigger an asthma attack.
Is this to say that someone who's asthmatic cannot exercise outside?
They can, but on a warm day, yes. And also, because there are things you can control, like the dust, the pollen grains.
Yes, pollen grains,
Yeah.
just the environmental factors can influence how an asthmatic patient can exercise from outside.
Yeah, so if they want to go jogging on such a day, they can tie a nice cloth or just handkerchief. Yes,
Around
above
the nose and the mouth.
Yes, just to make sure
Just
those
to
things.
keep safe.
Yeah,
As you've always
pollen.
said, safety is better than sorry.
Sure. So we'll start with the deep breathing exercises.
So then we can try to demonstrate that.
Yeah, so I'm demonstrating. Look at my stomach, it's bulging outside because of the diaphragm is pushing it down.
All right.
Try to do one.
All right.
Now we do the same, but we incorporate movement of the arms.
Okay.
So, as the arms move together to the center, you are breathing in. As you open out, you are breathing out. One more. Now we do the same while pushing the arms up. And now this time around, we are not try to avoid the breathing sounds. No, right. Just, yes. Let's go back to deep breathing again. Hold your stomach. With no sounds. Since he's a cardio exercise, we need to start with the warm-up. And this is a warm-up for this. Let's go. We are warming up. So let's go knee up. Side legs. Back to where we started. That's 5. Now I started jogging. So now we repeat the same with some speed. Let's go.
All right.
Let's go. Faster.
Now this is running?
Yes. Go, faster. It's counting 5, 4, 3, 2. So now we have to do some strength workouts. So let's go down. So we have the proper body alignment. Remember that we say that there are no mountains, no valleys. Align your back, have a neutral spine. Don't arc your back in or out.
On the toes.
Yes, yeah, there. Now squeeze the knee to the elbow. Give me 4 more, 2 more.
Okay.
So we are doing leg rotation. You support your back well. You sit on your arms. Circle your legs there clockwise. Let me come slightly back. I occupy my mat. Legs up. Let's go. 1, 2, 3, 4, 5, and clockwise. Give me 5 more. Now, have you done that? It's time to stretch.
So then, back at home, viewers, our expert is saying all the exercises that we do have to end up with a cool out.
Go forward, reach the edge of your mat. If you can, reach the edge of your mat. Are you there? How far can you go?
This is the farthest I can.
Okay, let's together. Yeah, let's stretch this part. This is called the quads. Let's go down. For someone who is very fit, they can go full range of motion. Do a stretch for the hip. Push it with the opposite. Yes, with the opposite arm. Push it. Not yet. Can I help?
Sure.
Feel the hip stretching and your lower back.
Yes.
So now we are finishing. In. Now we do the deep breathing again. Let's do the deep breathing again. Let's go in. Again. So that marks the end of access for the day.
Wow. Thank you so much for your time back at home. Keep doing the breathing in, breathing out exercises. I've enjoyed them. Remember, health is not an option. Health is a way of life.
Throughout the program, you have learned valuable lesson and acquired appropriate knowledge with regards to asthma. My name is Dr. Satsagai, a general surgeon and a public health specialist. Asthma is one of the major non-communicable diseases. It is a chronic disease of the air passages of the lungs that inflames and narrows them. It's not clear why some people get asthma and others don't, but it's probably due to a combination of environmental and genetics factors. Asthma cannot be cured, but its symptoms can be controlled. Taking care of yourself can help keep your symptoms under control, including 1. Exercising regularly to strengthen the heart and the lungs. This helps relieve asthma symptoms. If you exercise in cold temperatures, wear a face mask to warm the air you breathe. Number 2, maintaining a healthy weight. Being overweight can worsen the asthma symptoms, and it puts you at a higher risk of other healthy problems. Number 3, doing breathing exercises in order to reduce the amount of medication you need so as to keep asthma symptoms under control. Medication can control asthma. Avoiding asthma triggers can also reduce the severity of asthma. Appropriate management of asthma can enable people to enjoy a good quality of life.
A statistical fact about asthma is that in a single year, children suffering from asthma collectively miss more than 10 million school days. Asthma is prevalent on the Southern Africa region as opposed to other regions in Africa, with more than 20% of school-going children across the region suffering from this condition. Undoubtedly, asthma's biggest victim is children. Don't let your child feel down and low because he or she suffers from this condition. Cheer them on and let our children experience the full potential of whoever they want to be. I couldn't agree more with the anonymous writer who once said, "Asthma will not keep me from enjoying life. I beat asthma every day." My name is Bill Hawaka, and this has been Health and Flavor. See you next time, and bye for now.